New York is up next with Benjamin calling about high blood pressure. Hey, Benjamin, thanks for the call. You are live.
Oh, yeah, I'm calling for my mother. She's about 80 years old, 84 years old. And, hold on, I'm looking at my notes. She's been taking high blood pressure medication for 9 years. She's about 120 pounds, 4 feet 10 inches. And she's been seeing a doctor, MD, for 10 years.
Yeah.
For 1.5 months, her leg got swollen a month and a half ago.
Yeah.
Her foot got swollen.
Yeah.
So now what I had to do, I had to come by her cane to walk with. And 2 days ago, she collapsed in the kitchen while she was in the kitchen. I just had her collapse. Then I was in the living room there, and I rushed to her aid to lift her up, because she couldn't get up. So we took her to the hospital, and I started screaming her name because her eyes kept changing, changing. So I kept screaming her name, then she came back to life because she was unconscious for a while, So we took her to her MD. Our MD gave her some antibiotics, and they gave her some drips, antibiotic injection, and gave her some drips. This happened around 5 o'clock to 5:30 in the morning yesterday. And today again, the same thing happened between 3 and 3:30 again this morning. She said she was going to the bathroom. Then I followed her to the bathroom, monitored her movement, and she looked like she wanted to pass out again. She passed out again. Then I came to her aid again. The same thing I did, I screamed her name, and she came back to consciousness. And whenever she goes through all this process, she urinates and pass some bowels, and pass some feces, while she's doing it. And she started resting calmly yesterday, and the same thing, resting calmly after she went through this process. Then I called our MD this morning and explained everything to him. Said this could be a seizure, like a seizure, like someone going to unconscious for a while.
Yeah, look, it could be a lot of things, but let me cut right to the chase here, okay? The most common thing that causes this is low blood pressure. Low blood pressure, the most common cause of low blood pressure is a high blood pressure medication that's overprescribed. So,
okay, that's okay.
Did they change her blood pressure medication lately or increase it?
No, they didn't. One went for her high blood pressure test. They said it's 195. So they said it's 195. So she wasn't taking her blood. She stayed away from her blood pressure medication for a while. And after she had this seizure, what happened 2 days ago, where her foot swollen, then I had to take her to the foot doctor.
Yeah, I get it. So I can tell you what's causing that, too, presumptively. So with her blood pressure medication, have they changed it lately?
No, they've not changed it.
Has she changed it? Has she, mixed it up and she's taking more than she used to or anything?
No, she's taking like one pill every day, one pill. She takes one pill.
All right, so in the interest of time here, how much does she weigh?
120 pounds, 110, between 110 and 115.
Okay, so, high blood pressure from our point of view is caused by nutrient deficiencies. It can also be caused by a kidney illness. But if there's a kidney illness, that's also caused by nutrient deficiencies. So no matter which way you shake it, somebody that's suffering with high blood pressure would benefit from a medical nutrition program that supports and promotes healthy circulation. And I've got exactly what she needs. Swelling in the legs is caused by not enough protein in the blood. Not enough protein in the blood is caused by faulty digestion. Faulty digestion is a long-term effect of eating wheat, barley, rye, and oats. So there are 10 foods that she needs to stop eating. 10 foods she needs to stop eating. That's on my website. It's free. It's called the Good Food, Bad Food List. You can download it for free on my website. You need to get that list. Have her eliminate the 10 bad foods. I want you to eliminate the 10 bad foods as well. She needs to start salting her food so that it tastes good. Salt is unrelated to high blood pressure. The MDs are wrong. Start salting her food so that it tastes good. And she needs to give her body the nutritional support that it needs in order to have healthy blood pressure. If she wants to be measuring her blood pressure every day and look to see how she responds, there's a lot of things that can make somebody pass out like this. I doubt very much that it was a stroke, although, that's impossible for me to say over the phone. I think it's a blood pressure issue, but the only way that you're going to be able to determine that is if you measure her blood pressure. Does she have a cuff that she can measure her blood pressure at home with?
Yes. Well, I bought her a cuff to check her blood pressure. But
all right,
she went to see the MD yesterday, and they checked the blood pressure, and it was doing okay after she takes her medication.
Yeah. Well, it's hard to know because, when she takes the blood pressure medication, the blood pressure is often like a roller coaster, depending on how much of the medication is in your bloodstream at any given moment in time. So she doesn't have high blood pressure because she has a blood pressure medication deficiency. She doesn't have high blood pressure because she has a voodoo curse. She has high blood pressure because her body is undernutrified. Her body has run out of the stuff it needs to maintain normal blood pressure. So we got to stop eating food that's coming up the works. We got to give her proper medical nutrition, keep our fingers crossed, and see what happens over the course of the next 3 months.